welcome. Thank you for tuning in. I'm Dr. Anna Bossum, a naturopathic doctor by training here in the role of Integrative Oncology Specialist, and really want to highlight how you can, with some integrative approaches, complement your care alongside standard of care today. Let me see if, as I get familiar with advancing my slides here, no relevant disclosures. Important in getting started here, when we talk about integrative medicine or integrative oncology, there are a lot of terms thrown around, and I want to highlight what we're talking about today. Integrative medicine is this evidence-based use of complementary therapies alongside, so this and together, in conjunction with your radiation, your chemo, your surgery, or other therapies you're being prescribed. So important here, it is not an alternative or an either-or approach. It's that and together of kind of two different worlds coming down the middle to support you as a whole person for symptoms, side effects, and quality of life is the intention there. We're going to focus on a couple of different buckets of work today, and my hope is that you're able to zoom in on what is the most important thing that you can start working on. It's not everything, all or nothing. It's about putting one foot in front of the other so that for symptoms, side effects, or changes in your treatments for different stages or different time periods, you're able to hone in on this and together to help relieve symptoms, side effects, even support recovery from some of these therapies over time. All right, so important, we're going to talk about kind of the general things: lifestyle, nutrition, exercise, stress reduction, pain management, but also toward the end, highlight what to focus on, what to avoid alongside surgery, what to focus on and what to avoid for immunotherapy, kind of your IPI, Nivo, maybe Pembro. And then lastly, for targeted therapies, what to zoom in on and double down on, what to avoid, so that we really put safety first in the context of integrative therapies as well, so that we're doing no harm. Starting out with lifestyle here, right? And we want to think about what are the modifiable risk factors and how can we support you? And chief among them, top of my list always is asking if someone is using tobacco, especially smoking tobacco, how can we stop smoking cessation and really support a person kind of in their entirety? And here is a nice integrative approach, if you will, for auricular acupuncture, meaning fine needles are placed only in the ear, 5 on each ear, to support smoking cessation. And smoking cessation alongside this NADA protocol in conjunction with counseling, so kind of talk therapy around decision-making and stopping smoking, 40% reduction in smoking reported. The NADA protocol alone, 22%, so that added component of counseling really gives you that extra step in achieving goals related to smoking cessation. Next, risk factors here include where can we cut back on alcohol, processed foods, or some of the things that are considered kind of don'ts or avoids as much as possible. But when I talk to people about nutrition or lifestyle foundational support and making changes, I like to highlight what to add to their plate. What can we add that is a food as medicine approach to help you feel better and support you as a whole person? And highest on my list is making sure we're supporting you getting enough omega-3 fatty acids. If we had to make a generalization for what most people diets contain, is we get enough omega-6 and 9s and relatively don't get enough omega-3s. And upping your omega-3 intake so that relative proportion of omega-3s is higher than your 6 and 9 intake can be profoundly beneficial for anyone at every stage. Specifically, increasing omega-3 from seafood intake helps lower the risk and incidence of chronic kidney disease. Increasing your omega-3s can help relieve fatigue, improve surgical wound healing and recovery time after surgery, can lift brain fog, can take care of muscle health, heart health, and so much more. So I ask people, add that food of medicine support with either the addition of walnuts, extra virgin olive oil, or bonus points for really thinking about how do we lower your risk and incidence of chronic kidney disease, that salmon or other cold water fatty fish a couple days a week. All right, why do we talk about food, right? I get asked so often as a naturopathic doctor, they say, Doc, does sugar feed cancer? And it's not quite as simple as that. We want to think about how do we improve on your insulin sensitivity. So move you away from these mechanisms that push forward diabetes insulin resistance, and even high cholesterol and other kind of off lab values, if you will, and promote insulin sensitivity in a way that is protective and anti-cancer for you over time. It takes good care of your body. I ask people, if you get one takeaway from today, especially if you're more limited in how you're able to move, maybe recovering from surgery, or on those days where you're most fatigued, you get the most bang for your buck of minute you're moving by incorporating movement after meals. You're then hacking this priming of insulin sensitivity in your body by after the meal, making your muscles more hungry to take up the meal, therefore promoting the insulin sensitivity and moving your body away over time out of these mechanisms of diabetes and insulin resistance. So I tell people that 2 to 10 minutes can be seated heel raises, can be a gentle seated yoga, or it can be the household chores you would naturally do as part of kind of your everyday run-of-the-mill items you need to get done, but rearrange it to after that mealtime. Take out the trash, check the mail for after that dinner or lunch or breakfast time frame. Right. So why exercise? Why move? As we build on that strength over time and peel back the layers of the onion, movement in whatever way and form we can make it accessible to you helps reduce side effects from anti-cancer therapies, improve quality of life, and potentially in this lowering of inflammation and optimizing your body as a whole can enhance kind of the effectiveness even of anti-cancer therapies. So that is for your cancer treatment. Kind of keep it moving in whatever way you can, especially for your survivorship prescription, those people who have either wrapped up their anti-cancer therapies and you're just on these regular, if you will, surveillance scan schedules. We want to have you work up to a goal of exercising 30 minutes, 5-6 days a week. And it can be gentle exercise like Tai Chi, Qigong, yoga. It doesn't have to be hitting the gym, but mixing it up and getting you moving helps reduce the risk of cancer recurrence, decrease cancer-related fatigue even after you've wrapped up cancer-related treatments, and lifts the entire tide of boats related to mental and physical well-being, to reducing anxiety and depression, and so much more. So why is it that physical activity is so important? In moving, getting your muscles involved, you're increasing the metabolic activity of your body. You're helping improve that insulin sensitivity, which we really give a big thumbs up to in integrative oncology. In all that, you decrease inflammation, optimize your immune system, and insulate your body from negative side effects from cancer treatments. And here's kind of over time, or if you go back and watch this recording of the talk today to zoom in on, right, everything is connected. And exercise helps us moderate our sleep-wake cycle, our stress hormones, our signaling molecules related to hunger, satiety, and so much more. So movement is a way to hack even those 2 to 10 minutes of engaging anti-cancer mechanisms for your body as a whole. Out of movement and into sleep, right? That everything is connected, and a good sleep-wake cycle helps improve memory, concentration, and the ability even to learn and uptake new information, supports your physical health, your mood and emotional well-being, and even regulates your appetite. So if stress hormones are here, our hormone for going to sleep, staying asleep, melatonin, takes a hit and stays low. Rather, as we bring those other signaling hormones down, such as stress, and optimize melatonin, we can help rehab your sleep-wake cycle. And your habits are a big part of rehabbing that sleep-wake cycle. So we tell people, aim to go to bed and wake up about the same time every day, even on weekends. Make sure your environment is conducive to getting a good night's sleep, and get in bed so that you're planning to have gone to sleep and be able to stay asleep for 7 to 9 hours a night. Generally, women need a little bit more sleep than men. So kind of plan accordingly and build on that process over time, because your sleep-wake cycle, important if we think of this and together integrative approach for you as a whole person. That takes us out of lifestyle and gives us a nice, if you will, transition to how do we combat stress and anxiety in an integrative way. It's important because everyone at every stage of life or after a kidney cancer diagnosis can benefit from this. In reducing stress, reducing anxiety levels as a whole, we improve on your overall well-being. We decrease heart disease risk factors, we decrease heart rate, blood pressure, Improving on your blood pressure, so taking high blood pressure and bringing it down, is excellent for your kidney health over time, and even can moderate and lower inflammatory markers we can measure on blood samples, such as C-reactive protein. So all sorts of different systems or mechanisms and molecules in your body are touched by reducing stress and anxiety. But how do we do this, right? I tell people, when you're new to stress reduction and anti-anxiety measures, it's like flavors of ice cream. You can go to the ice cream parlor shop and sample all these different flavors, and sherbet might be a miss, right? You have to sample through to find out what speaks to you, and here are a couple of different ways. The key, if you will, the light switch to turning on anti-anxiety or parasympathetic nervous system activation, this rest and digest function we want to encourage for you, can be done by engaging the vagus nerve. The vagus nerve runs from the base of your brainstem past your vocal cords and touches every major organ on its way down and out. So simple things as it comes by your vocal cords, such as extending the exhale out for breathing, laughing, singing, humming, gurgling, engages your vocal cords and engages the vagus nerve as a byproduct. So they're little hacks and stacks that you can easily integrate vertically into your day. It's not always about finding a 30-minute time frame for meditation alone. It's little things you can do little by little, again and again, to build tone into the nervous system activation, to get you out of fight or flight, and more reliably spending time throughout the day in rest and digest. Another one we'll highlight is music therapy, movement, acupressure, before we move into moderating pain. So important, right? Boosting your mood. This, Joel alluded to it, like really living in gratitude and a positive mindset, no matter what's going on around you, helps shape the resiliency filter. So as stressful things come at you, they're filtered out so that you're affected a little bit less. And that can be done through a variety of different ways. And here's an SIO guidelines article that was published just last year that got ASCO endorsement for different ways, different flavors of ice cream, if you will, for engaging reduction of anxiety, improving on depression. Here are a few things that make it specifically important for kidney cancer around the time of surgery even. As we reduce anxiety and stress, even leading up to surgery, we improve on inflammation markers and the burden of that inflammation on the immune system. And that directly leading up to and through the time of surgery, the better we can control stress. You significantly reduce post-operative pain scores and even the need for opioids, the heavy prescriptions we often need to write post-operatively for pain. So the less pain medicines you need, the more optimal, if you will, your post-operative time can be in wound healing and return to bowel function. So this and together of bringing in the little hacks are very important for improving your post-operative pain. Other things, even if it can be done passively for when you're getting your CT scans, listening to music can be important. Even one session of music therapy related to any procedure or scan or time that it's being administered of music of your choosing or the surgeon's choosing can help significantly reduce pain and anxiety around, before, after the time of surgery. So reducing anxiety, music, setting on, if you will, AirPods or headphones, and even a single intervention. So think of it as something to turn on music in the car as you're driving to an appointment that might be weighing heavy on your mind, and moving things along in that way. Acupressure. So many people have heard of acupuncture. Acupressure is how you can press on points at home. This is a great thing to put into YouTube to actually get a demonstration video. I wasn't able to faithfully integrate them here, but yin tong, PC6 or pericardium 6, which we'll revisit, nausea, vomiting, and heart 7, all reduce anxiety by pressing on these points that you can do or a loving family member or caregiver can assist you with. So yin tong is in the space between your eyebrows where those kind of 11, the furrow line, come together. You can tap it or gently massage it. Pericardium 6 is 3 finger breaths below your wrist crease. And heart 7 is on the inner part of your forearm, but that actual wrist crease and the side directly under your pinky finger, this point in that wrist crease and on the tendon there, in the bone. Other resources include kind of in the palm of your hand, mindfulness-based stress reduction tools. And here are a few things to explore. I hear excellent patient feedback from 10% happier. These are ways that you can plug in with headphones or just on a speaker, app-based devices in the palm of your hand to take on the go or play as you're getting ready for the day or night or just moving through a stressful time. All right, and then here is, if you will, kind of our pivot into integrative approaches to pain. So mindfulness-based stress reduction is one way, but just in the way that there are many different flavors of reducing anxiety, and an anxiety reduction also helps support reducing pain. We're going to lean into that. So there are many, many different ways, via or alone, in reducing anxiety or reducing pain, to think about acupressure, yoga. This is that coming together of the mindfulness-based linked in time to breath and movement, that acupressure, massage, or other ways to bring, if you will, integrative approaches to resolving pain. And we'll talk about highlighting a few. The most important one I like to think of, and that many of my patients come to us not having tried yet, and we send them to our integrative clinic to receive acupuncture. So acupuncture is very, very safe for any patient at any stage. In over 7,000 patient appointments here, we've not had an adverse event yet, and we really see patients across the entire cancer care continuum of many different diagnoses here at Winship. And it is a way to effectively reduce cancer-related pain. And what I often see is also reduce the need for medications, prescription medications for pain, or even sleep. And this is applicable to patients who are having acute pain, so pain that has suddenly come on and we need to support, whether it's in a joint, a muscle group, or any place of the body, or chronic pain, things like chronic low back pain that might have already existed before the time of diagnosis and more. All right, acupressure, Shen Men, large intestine 4, help relieve pain, even around the time of surgery. And importantly here, we want to think about if we can reduce pain, we need less of those prescription pain meds. So this is a really feasible and cost-effective way to press 2 to 3 minutes at a time, once or multiple times of the day on these points of the body. So this is LI4 between your index finger and thumb. Here are the instructions to revisit later, just in the interest of time today. And then Shen Men. This is one where a family member or a friend really ought to watch the video with you or read these instructions so that as you work to find that spot on your own ear, they're able to take your thumb, your index finger, so that you're pinching your ear and you know with confidence you're on the right spot. It's hard for us to look in the mirror and find that point on our own. Natural products for pain management and support. And I wanted to highlight a few, the ones I probably reach for the most. Importantly here, working from the bottom up, asking your medical oncologist or your surgeon to consider testing for a vitamin D. This is a simple blood test that can be added to any upcoming lab draw, because low vitamin D runs with a few things, including insufficiency, tends to run with higher pain signaling in the body. So it's low-hanging fruit that we ought to check on. Then we have topical options. So this is great for that low back pain or pain in other muscle groups or joints and bones. It's called Tea Relief, and it really can be found in any Sprouts or kind of natural grocery store. Apply that generously 2 to 3 times a day. I see that magnesium can be really helpful for my patients. We can test magnesium in the blood, but it doesn't really give us an idea of where it goes in the body. I go based on symptoms. So especially if you're having muscle cramps or muscle cramps that are waking you up at night, adding a magnesium glycinate, which is well absorbed and not touching a risk for diarrhea so much, is a good place to start. Lastly, at the very top here, I want to highlight a homeopathic remedy called Hypericum perforatum. Importantly, this is a homeopathic preparation of St. John's wort, so very, very different than the crude herb. And as a homeopathic preparation, excellent for its cost. You're talking about less than $10 for a little vial to get you started. So an excellent price point in integrative medicine, no drug-herb interactions, and can only be helpful. So it's a good place to start. Hypericum perforatum as this homeopathic remedy, helpful for supporting relief of sharp shooting pains in the body. Other products for pain management that I often reach to is PEA. PEA is a cousin to CBD, and so it acts on the same receptors in the body, but has no drug or interactions of any kind, has been extensively researched. PEA dose 200 to 600 milligrams. I like to start people on twice-a-day dosing, but you could drop down to one after you've had benefit over time. Helps reduce inflammatory and pain-related signaling, not only for chronic pain in joints and muscles or the low back, but neuropathic pain as well. So if you have that sharp shooting pain, fingers, toes, or other places, this can help be a natural and together solution for relieving pain related to a natural product. Nausea, vomiting, some other GI symptoms before we wrap it up for the different treatment phases. Ginger, excellent for relieving nausea, vomiting, and the dosing can be variable, or even the form you give it in. If you prefer tea, I encourage people 2 bags of tea per cup of brewed tea. The chews, the candies are okay too. Or if you do a crude herb, if you will supplement, the dosing can be 500 milligrams to a gram every 4 to 6 hours. So it's really use as needed, increase if you need it. You can always back up. You know you've had too much if you're getting the most common side effect, heartburn. That is a cue to back it off a little bit. Second here to highlight in terms of products and support, another homeopathic remedy. I think homeopathic remedies are a great place to start because of the gentle nature they work in and the cost-effective price points you can buy them in. Nux vomica at 30C, 3 to 5 pellets under the tongue once or several times a day as needed. Helps nip that nausea in the bud that is like, oof, I've had too much to eat, even the smallest bite of food, like, I find that that is the remedy that people respond to the best, Nux vomica. Acupressure. So that PC6 that was also helpful for anxiety reduction also helps relieve nausea, vomiting. People can press on this point, that's 3 finger breaths below, or wear those motion sickness bands. And we actually find that PC6 for nausea prevention can be just as beneficial as some of the prescriptions we write. So I encourage all my patients who might receive nausea from some treatments or deal with nausea on the regular to wear these motion sickness bands kind of around the clock. Remove them for showering and bathing, but it's safe to wear morning, noon, night, even throughout the night as you sleep. If you need a rescue remedy for nausea, vomiting, isopropyl alcohol. These are the little alcohol prep pads that people are using to clean the skin before they take a blood draw. It's a nice way to have something in your back pocket to rip it open, hold a little bit away from your body underneath your nose, and just take a slow breath in and out. May kind of abort nausea, vomiting. And then pepper oil, if you will, aromatherapy. So whether you're putting it on a little felt pad and wearing it on your clothes, or taking the little bottle with you and holding it underneath your nose, and just kind of taking a couple slow, deep breaths can help relieve nausea, vomiting as well from that integrative approach. Constipation. Even after the time of surgery, we want to think, how can acupressure help, or modifiable behaviors? This is why you get up and going after surgery. But if it's away from surgery, we can think about other strategies here as well. Away from surgery, so you don't have that midline incision or surgical sites that are healing, we can think about abdominal massage in that clockwise direction that your bowels are traveling in. Magnesium citrate. This is different than the magnesium glycinate for joints or muscle pains and muscle cramps. Magnesium citrate is an osmotic laxative, meaning it pulls water into the bowel and helps clear bowel and move things forward that way. Stress reduction techniques help too, because as we move out of fight or flight and into rest and digest, we're able to move our bowels more effectively. A way to encourage that further is acupressure, and ST36, as well as hydration and movement, can be helpful after the time of surgery. Talking more about ST36. ST36 we'll have highlighted and have a little picture when we talk about fatigue, but is a point that you or caregiver can support and press on once or multiple times a day, and it helps wake up your bowels after surgery or different anesthesia events, right, where you've had to go to sleep or being given pain medicines. So that helps, if you will, the moving sidewalk wake back up after your surgery, so you're moving your bowels more effectively. So that acupressure is on your leg at that point. It's also one of the main points for fatigue, so we'll talk about it more here in a minute. And when you press on acupressure points, you want that oof, that's the spot sensation, but avoid it being frankly painful. Last gastrointestinal symptom here before we move into fatigue in our specific treatment stages. Diarrhea from treatment and integrative approaches to be considered is a very specific probiotic called Saccharomyces boulardii. So there's many different causes for diarrhea. If we've ruled out frank infection, but diarrhea kind of persists from treatment, we can think about Saccharomyces boulardii, and this can be found at any Walgreens type of store that has pharmacy aisles. Is a beneficial yeast that helps lower inflammation, promote the normal, if you will, function of your gastrointestinal digestive system, and relieve diarrhea, whether it's diarrhea from your treatment or even diarrhea that can come from antibiotic-based prescriptions. So this is an easy one to add kind of in a 2-a-day dosing. As well, if people are having diarrhea, I always want to make sure to connect them with a nutritionist to think about what soluble fibers can we add. This is often, if you will, referred to as a brat diet. This bananas, applesauce, rice, toast approach to help be really gentle in supporting relief of diarrhea from that food-based approach. Now, fatigue. Lest we forget that movement, even gentle movement, helps relieve fatigue. Your omega-3 healthy fats relieve fatigue and lower inflammation, and stress reduction techniques lower inflammation, boost your energy as a whole person. Then we have a couple of acupressure points we'll talk about here in a minute, and a couple of supplements we'll highlight. And importantly here, we see that vitamin D crops up again. Vitamin D we talked about as getting a blood test for checking related to pain. All right, acupressure. So this was a sophisticated clinical research study from colleagues at the University of Michigan, found that acupressure, both kind of, if you will, activating as well as relaxing acupressure techniques, significantly relieved cancer-related fatigue, even improved quality of sleep and quality of life. So this is a way that you, for 10 minutes a day, can press on these various points, and we have ST36 highlighted again as a once daily routine, and kind of work your way down the body and gently massage these points with that and together, if you will, approach. This is a sample of a handout we developed here for patients at Winship to say, here, 10 minutes a day, this is the place I'd like you to start for relieving cancer-related fatigue and increase your omega-3s and incorporate gentle movement. I always try to think about what are the 2, 3, up to 5 things maybe that someone can do, but we really aim to build on progress over time with our recommendations. So integrative support for the time of surgery. Important to highlight here is the role of nutrition, specifically immunonutrition. And this is a growing field of research, even specifically for urological or genitourinary cancers. And here at Emory, our Integrative Oncology director has developed a website in combination with his research fellows called frailpatient.com. This is a way to make a homemade smoothie immunonutrition recipe that you can start 3 to 5 days before surgery, and has research to suggest decreases hospital stay, improves on post-surgical healing, and decreases post-op related infections. So this is a way with the food on your plate to be really intentional, to build up the tank and the reservoir of your body's nutrients needed for your immune system, inflammatory signaling to operate and function properly after surgery and supporting recovery. Because as we help with that, we can get you moving faster, onto the next stage of treatment faster, and so much more. So here to highlight the things to keep in mind: that nutrition, select supplementation, which we'll highlight here next, and as well the things we said: stress reduction, those 2 to 10 minutes of movement after meal times, really emphasizing your sleep-wake cycle, and leaning on community, right? Having your friends, your family members support along the way. Here are the things that are, if you will, supplements to hone in on if you're either following an immune nutrition guidelines or thinking about additional nutrients or vitamins or supplements that support wound healing. Your omega-3 fatty acids, your arginine, and your glutamine are the 3 mainstays of immunonutrition support. Bonus points for the inclusion post-operatively of vitamin A or hydrolyzed collagen, as this helps the linking and the healing actually of the skin and coming back together, and making sure you're having the building blocks on board to do some of the heavy lifting of your body. Important things to avoid around the time of surgery: anything, and here are a couple of examples, to either interfere with blood clotting. We do not want to increase the event of bleeding related problems, or the potential interference with anesthesia. I won't go into these in depth, but here are a few examples, and especially highlighting some of the things I see patients might already be taking that are important to discontinue. Melatonin was on this list of what do you pay attention to in terms of supplements around the time of cancer-related surgeries. And I want to highlight melatonin here because it helps potentially reduce anxiety and depression, lift brain fog, and around the time of surgery has evidence that suggests it reduces pain and helps people need less pain medications after surgery, and may even help with the return of sensation of the area that had surgery. So it's a way to, leading up through surgery, and then once you're back to normal food, have a way to be intentional with your lifestyle. We already talked about how do you reduce stress and optimize the signaling for a sleep-wake cycle, lean into foods or maybe a supplement to boost your body's melatonin levels. Foods to highlight here that include melatonin are pistachios and tart cherry. Those are two examples. Integrative prescription, if you will, for immunotherapy, and each of these have evidence to support them. Vitamin B5, magnesium, and your lifestyle for supporting your gut microbiome all have evidence to support. They help your immunotherapy medicines do a better job because that environment, the quality of the soil, everything is happening in for that immunotherapy to do its job is optimized in favor of that medicine. So B5 and magnesium, you can think about, do we want to do a blood test first or supplement empirically? This is really a question for your medical oncologist. And then your gut microbiome, these are the little bugs that live in your digestive tract. Your lifestyle helps. Reducing anxiety boosts your gut microbiome, as well as diversity in your diet. I've heard this already talked about today, right? Incorporating anti-inflammatory spices, eating plenty of fruits and vegetables, so that diversity, and then high fiber. So my prescription, I tend to tell people for optimizing your gut microbiome, at least 20 grams of fiber a day and 30 different fruits, vegetables, legumes, grains in total a week. And this includes your spices. All right, almost to the end here. Reducing pain, and here's that summary of things we've already talked about. Movement, acupressure, maybe a supplement of omega-3s or PEA, and further alpha-lipoic acid. Alpha-lipoic acid is more specific for the pain related to peripheral neuropathy, but can definitely be tried alongside immune checkpoint inhibitors or your immunotherapy. For rashes, in addition to your care team's guidance for the conventional care, our most common, if you will, integrative additions are either a calendula cream. This is a way to topically relieve itch and promote skin healing. Homeopathic sulfur as a way to reduce the sensation of that itch from the rash, in a way to bring in a product, or oatmeal baths or poultices. So kind of putting oatmeal in a sock, tying it up, and making yourself a nice warm and gentle bath at home to relieve the itch. Further, for your, if you will, targeted therapies, those medicines you're taking at home, what are the integrative things for hypertension, diarrhea to go back to, nausea, vomiting to go back to, relieving muscle cramps, so supporting your hydration and repletion of electrolytes, including magnesium, and thinking about how do we reduce pain if it's part of the symptoms that are holding you back. And I want to really highlight and reemphasize PEA here, one of those main pain supplements that I talk to many people about. Important avoids alongside either your immunotherapy or your targeted therapies. And important here for your immunotherapies, we want to avoid anything that is potentially to touch your immune system, or even probiotics, or thought to be especially over just off-the-shelf probiotics, something to avoid. So avoid immune-stimulating botanicals like Astragalus echinacea. These are things people talk most about during cold and flu season, those off-the-shelf probiotics and medicinal mushrooms such as turkey tail. Alongside your targeted therapies, anything that interferes with maybe your liver's ability to process and eliminate these medications so that they're eliminated in a time-appropriate way, you want to avoid. And chief among them here are the crude herb botanicals of St. John's wort, Schisandra, golden seal, ginkgo biloba as ones I see people probably use most often that I advise to avoid. To think about this as a way to put one foot in front of the other. None of the supplements will ever be a replacement for the lifestyle. So really think about those comprehensive small changes you can make over time. Lean into that food as medicine approach for a cost-effective way to support you as a whole person and a symptom directly. Acupressure costs nothing at all apart from the time. And then the quality of your nervous system signaling, reducing anxiety for supporting everything else. Supplements are merely, if you will, the sprinkles on top of the ice cream sundae. They aren't the foundational piece that I talk to my patients the most about. Really, we want to think lifestyle, food as medicine, acupressure, stress reduction, and last, and not as a replacement for any of the above, natural medicine or supplement products.